Hi, I'm Terry Fagan, Director of Clinical Services for Consantas Pharmacy. And today I want to talk for just a few minutes to all of the incredible staff at each of our customer facilities. I am so proud of the courage and strength you've shown in fighting the pandemic over the past year. Your work has been nothing short of heroic, and we can't thank you enough. Now that we're on the road to recovery, it's important to know that COVID-19 vaccines aren't just another tool in our kit to end the pandemic. They are the solution. Because it's so important, I'd like to address some common misconceptions about the vaccines and hopefully set some of your fears to rest for those of you still reluctant to be vaccinated. In my job and as a pharmacist, I hear a lot of questions and concerns. Many concerns are a result of misinformation or rumors from sources such as social media. You've probably seen the TikToks where someone sticks a spoon to their face to show that they've been magnetized by the vaccine. Others are afraid tracking devices are being injected with the shot, though some of my colleagues have pointed out that if the government really wanted to track us with microchips, they'd probably do it through our cell phones or chicken nuggets. Maybe they're right. The fact is, the vaccines do not contain metals, harmful substances, or microchips. The point is, there's a ton of misinformation out there that I believe is fueling much of the reluctance to get the vaccine. Today, I'm going to share accurate, unbiased information to hopefully dispel the falsehoods and help set your minds at ease. The most common concerns I still get fall under two categories. They are the vaccines safe and are they effective? These are questions I can answer confidently with one very short answer. Yes. But more specifically, let's tackle and dispel 5 of the most common myths. First, these vaccines can't give you COVID-19 since they don't include any live virus. Instead, the vaccines simply trigger the immune system to create antibodies against the disease. Any potential mild symptoms one might experience, such as headache, body aches, or fever, are related to you having an immune response to the vaccine, and that's a good thing. I can assure you that any symptoms related to the vaccine are far preferable to dying of coronavirus. Second, the vaccines do not affect your fertility. The Centers for Disease Control reports that there's currently no evidence that any vaccines, including COVID-19 vaccines, cause fertility problems or are harmful in pregnancy. If you're trying to get pregnant now or in the future, would-be parents can and should receive a COVID-19 vaccine. Number 3, vaccines can't change your DNA. It's impossible. Some people have misunderstood what mRNA is and how it works, but the truth is the vaccine doesn't affect your DNA at all. mRNA is messenger RNA, and in this context, it refers to a piece of the virus spike protein. As I mentioned earlier, this molecule contains a genetic code that instructs your cells to create antibodies against the coronavirus. To do this, the mRNA doesn't even enter the nucleus of the cell. The cell breaks it down and removes it after it's finished using the instructions. Fourth, some people are nervous about how fast the vaccines were developed and approved and fear this can impact their safety. I can assure you, the testing was thorough and absolutely no safety corners were cut. Many countries worked together with rigorous safeguards in place, and the only thing that was cut was the red tape to get it to the market quickly. Fifth, another question I get frequently asked is, should I get vaccinated even if I've already had COVID-19? And to that I say absolutely, unequivocally, yes. That's because while having had the disease offers some protection against future infection, there's not enough data about that level of protection to know when it tapers off or how protective it is. When I talk to people who are reluctant to be vaccinated, I remind them that nearly everything we do in medicine and in life carries some inherent risk. All medications have potential side effects and risks. Sometimes the risks and the benefits are nearly equal, and choosing the right path is difficult. However, with the COVID-19 vaccine, the risk of the vaccine refusal has proven to be substantially greater than the very small risk of taking it. The benefits or efficacy is extremely good, beyond all doubt, in fact. So this is where trust comes in. We inherently trust scientists and other professionals every day, all of the time. If you think about it, we trust the pilot when we get on a plane. We trust the anesthesiologist when we go for surgery. We trust cooks for our food safety. We also trust that the many medications that we regularly ingest have the right ingredients, and we take them willingly. So why should we not trust this life-saving vaccine? Statistically, you have a greater chance of winning one of the state prizes or lotteries for being vaccinated than you do for having a serious reaction to the vaccine. I hope this quick overview of the myths and the facts around COVID-19 vaccination has been helpful. But if I haven't addressed your concern, please reach out and let me know. Being vaccinated is so important, not only to protecting yourself, but also your family members, friends, the residents you care for, and the country at large. The vaccines are the path to ending the pandemic, getting back to normalcy, and doing the things we've missed for the past year and a half. Once again, thanks for all you do on behalf of your residents every day. You've sacrificed so much to keep them safe and protected, and I believe the vaccines give you the opportunity to do the same thing for yourself. Thank you.